All right, Dr. Emer, we are live.
Hey guys, it's Dr. Emer. Ooh, my goggles are getting foggy. We are here doing Halo as part 2 of our acne scar treatment for a patient that has some deeper textural issues on her cheeks and around her mouth. It starts to build up a little bit of heat, so she's going to start to feel it in a minute. Right when we finish, we'll put more numbing on before we do our CO2. But you guys could see Halo's our favorite.
SCITON's on here already. Quick.
SCITON Incorporated are on there. Excellent. So, as you guys know, our favorite fractional hybrid laser is Halo because it does two things. It goes deep with the 1470 and very superficial with the erbium. Just a few more passes. You guys can see all the little dots that are forming with the erbium right there. Those are going to improve a lot of her textural concerns. But those deeper scars that she was having that we had to fill with the Bella fill, that's going to improve a lot more with the CO2, but also with this deeper 1470 component that you can't really see. Or turn to me just a little bit.
Someone's saying you're super aggressive.
Yes, that's true. How did they know?
You have to be to get the results.
I know. That's why we get good results, because we combine and we're more aggressive. But our pre and post procedural protocols, that's what's key. Otherwise, she wouldn't be able to do this with her skin tone, despite how light her eyes are. Okay, last pass. So we're gonna put more numbers. So the next step is gonna be to combine.
Is she awake? Yes, she's awake.
Awake.
She's awake.
She's awake and well. We have SCITON Josh over here.
Hey Josh,
Next
we're gonna
week.
be in New York very soon with a lot of
Dinner next
filming.
week.
Jordan said there's a lot of people wanting to film. This is the last pass.
I'm applying tretinoin. Can I still have this procedure done?
Yes, but I want to tell you guys, tretinoin is not my favorite for cosmetic purposes. It's really good for acne. Okay, we're going to numb. Go ahead and take
Alright,
this.
we'll wipe it off.
We're going to wipe off those dead cells. Go ahead and turn. Go ahead. She's going to renumb you on that side.
Why this combo of modalities?
Because we want to get a lot of resurfacing in one treatment, and studies have shown that combining non-ablative and ablative lasers together give a better outcome. Also,
Someone's asking, do we numb the face, guys? Look over there. Bianca, the MA, is numbing.
she's sending numbing, and we already have numbed topically and injection-wise. But combined, these combinations really need a mix of things. The other is the CO2 is going to give her a lot of improvement, but to enhance that, we combine it with the Halo. Now you can combine Halo with profractional, you could do it with microneedling radio frequency, you could do it with CO2. It depends. I just want to get her more, and this will limit her downtime because she's not doing CO2 on the full face. That's why we're combining that. Now the deeper scars that required volume, we did the Bella fill, which I think are going to be really good. I think her left side is probably going to need a little bit more. Or no, sorry, the left side I think is going to be fine. I think her right side might need a little more, one more time, and that's it. We did do a couple syringes. And then what else? What else are they saying? What's key is her post-procedural healing.
Is it okay on black skin? Yes, it is, guys. Depending on what setting we're at, we've used it on our surgical patients with darker skin for their surgical scars.
Yes, we did. We have a
do have
Boca
some
Live.
lives. We've done it for acne scarring on the face for our darker skin patients. Well, we have that on live too.
So we'd have to see
What time do you guys close? I don't think we go.
I don't know. Jordan and I never sleep, so
We
I'm not
don't close.
exactly sure. No, typically our last patients are 5, 6 o'clock, but we're here a lot later because we're doing lasers and we're doing treatments. And you guys know how early we were here today too, because we did our gladiator makeover.
What
Very
you like
excited.
instead of retin-A?
So I like retinol specifically. There's different types of retinol. I use a couple times a week Cosmolon 2. The other days I'm using Vivacia foam or my Rev retinol. Around my eyes I use Sente BioComplete, which is a 0.2 to 0.3% retinol. So if you consult with us, we can go through a whole protocol with you, MRCosmetic.com.
Can you do this on the butt for uneven skin color?
You can, actually, and we just did it on a guy's chest and shoulders when we were in Boca. And you can do it in other areas, but that may not be the primary treatment.
How much do you charge? How long will it last? You guys need to send us a DM, full name, email, phone number to get in touch with us.
Turn a little more to the right.
Someone said, I would love to know why you choose this industry.
Well, that's a really good question, you guys. I have been doing this a very long time. When I first started, I wanted to be a rhinoplasty surgeon. And then I realized I didn't want to do surgery, but I wanted to do stuff related to surgery. And I was already really experienced, so I went into dermatology. Remember, at that time, I'm pretty old now. This didn't exist. I created this with our social media and with just over time, the improvement in cosmetics and the building of cosmetics.
Someone wishes they were local because they're in Chicago, you guys. You're just in the middle. You can choose to come see us in New York or in Los Angeles or in Florida.
Boca. And I'm from Chicago, you guys, so thanks for following.
Someone says, I need a BBL, guys. Come see us. Send us a DM.
Which BBL?
Which BBL? The SCITON BBL or the
BBL to your booty, like we just did today, or we tried to do today, but we couldn't. We had to do his chest only.
They want to know, what was your career path?
My career path originally was plastic surgery, and then I decided to go into dermatology. I did dermatology and then skin cancer surgery and a lot of improvement with lasers for scars, and then it led into everything I do today. None of this was taught in my training, you guys. I did this all on my own. So if you're a resident and you're trying to get into this, I best you do a fellowship with somebody like me. It's really hard to learn. Any inquiries
like that? Someone said,
perfect.
So being from Chicago, does he call it soda or pop?
Oh, that's a good question. What do I say, Jordan?
Soda.
Soda all the time. Okay, that side's done. We're gonna add more. Yeah, I would say, give me a diet soda all the time. You guys know how much I love Diet Pepsi and Diet Dr. Pepper.
Josh.
Were you right?
Josh was.
Oh yeah, with a lemon. You have to have it with a lemon. Yes, it's the best. I know. Oh my god, it's so good. Do you like Diet Dr. Pepper? It's literally my favorite. I love it.
People are saying you're amazing.
Diet, and I have not had as much soda. I can't even believe it. I've been drinking tea and just having a lot of water. I can't even believe it. I don't even know. I'm more vascular too, so maybe it's better for me. I need to go on soda though. That crunches it first. No? Okay, good. So we're doing her forehead now. You guys can see the erbium with all the dots there are going to resurface some of these fine textural areas that she has. She doesn't really need the CO2 here. But the numbing really is going to help because we're going to go cheek by cheek. Make sure you get all the way back there, okay? Go ahead. A lot in there, spread. She's doing really good. She's a total trooper. This is going to be the start. Now, my opinion is after a couple treatments, you should do these bigger maintenance treatments every 4 months or so, but you may not need the CO2s, but you can do things like Halo with microneedling radiofrequency, or even Moxie with microneedling radiofrequency. But for right now, because we're trying to attack these scars, we need to do bigger treatments. And it's really important you guys follow my Emerage Cosmetics protocols. Afterwards, yeah, go ahead.
Can you explain the long-term use of hydroquinone, please?
Not on here, guys. Not on here.
Consult, right?
Make a skincare consult or a regular consult with me, and I will go through everything with you.
To do that, guys, send us a DM. Full name, email, phone number. Is she up, guys? She's awake. You can say hi to that.
I'm awake.
She's awake. She's not fully happy, but she's doing great. She's hiding it really well.
It's tolerable.
Okay, good. So this side's almost done. So the hard part was really the cheeks. That's the hardest part. Perfect. All right, so that side is done. And the thing is, you guys know, the reason I got into this was because you can see the dead cells, wiping those off, is because when people had skin cancer and a lot of scars, it was very self-conscious, especially having those scars on their face. And so we tried, at that time, everyone used to say, wait months and months before you do anything for a scar. But obviously I didn't want to do that. So I started doing peels and I started doing lasers and derma rolling, and noticed that the scars improved. Instead of waiting 6 months, we did it immediately. Same thing for my patients on Accutane. We treated them immediately. So, can you come wipe this off a little bit right here? So, not that far, just here. Here. Thank you. So, that's where spawned the starting lasers. And now the protocols are that about 3 weeks after suture removal or after surgery, you need to start lasering to remodel the scars. What other questions?
That's it.
So pre-treatment should always be a lightening and exfoliation peel, and post-treatment we want to use my Hyla B, AOC, Refit Base and Eye, and make sure that you are always using a barrier repair cream, some sort of enzymatic polish, and a stem cell like our anti-age stem cell.
Does this work on pale white skin?
Oh, it's even better. You can go much stronger. This is still strong, but you can go even stronger. I had one of my ginger patients today. She loved it. It's super strong. All right, last pass. Okay, now we're gonna get her nose. Again, look at those dead skin cells, guys. See all them? Gotta get all those. Those are all the little holes that you see here. It's all the dead cells from there. So these are basically, go ahead, textural issues that we are just wiping away from the skin surface. Hold on. You don't need any, we're not doing the CO2 on the forehead, so. So we want to do her pores. We want to get her nose area.
Do you feel like your skincare line filled a gap in medical grade skincare?
Yes. Does it fill a gap? Yes. It's used for pre and post procedure, and it can help people heal. It complements really well with other skincare lines, specifically those that have stem cells or a lot of retinols, and mine are more potent and more calming. So the vitamin C is going to be a calming vitamin C, hyaluronic, more hydrating. It's going to basically incorporate into anything you already do and enhance what you already have done.
What is the white cream on her face, guys? That is the numbing cream. We're going to do our CO2 laser next.
And we're doing our amazing goggles from Innovative Optics. You guys see I just twisted the centerpiece there so that we could get right into the nose, the bridge of the nose, much more easy. Great goggles. So now we are done with Halo. And we are going to get ready to start our CO2 resurfacing. She did really well. Were you okay?
Yeah.
She did great with topical and with injections. So stay tuned. We did our CO2. It's now saved. Make sure you save.